And welcome to the Dr. Bob Show. The next 30 minutes will be one of the funnest times that I have on television because I'll be picking topics that I think will be important to your health. Anything from the central nervous system. We may be talking about strokes. We may be talking about dementia. We'll be talking about the eyes, about dry eyes. Why do people have dry eye syndrome? We'll be talking about the vascular system, about how we feel a pulse. What does a pulse mean? We'll be talking about risk factors for heart disease. We'll be talking about certain types of allergy problems that people have. We'll be talking about musculoskeletal problems, broken bones, joint replacements. We're going to have a lot of information. Do you know how to get a good night's sleep? Hopefully we'll be talking about that also. So we've got a lot of packed information for you, and I think we're going to have one of the most fun shows that we've had. So you'll want to stay tuned as we get ready to have medical information for you. Let's pretend we're walking into a doctor's office. We've got a medical problem. The first thing that the office will want you to do is fill out information. That information is very important because it'll talk about your medications. That will help the doctor know how that fits with the problem that you have. He'll want the family history, very, very important. People are living longer, so it's important to know about mom and dad, what kind of medical illnesses they had, or siblings. And so what the family history is very, very important in trying to determine what's involved in your health. Then we get into the physical exam, and that's what I want to get into. When we go to the doctor's office for the physical examination, he'll want to get your blood pressure. What is the blood pressure and what does it tell us? Because a high blood pressure can be a silent killer. A low blood pressure usually doesn't mean anything unless it's all of a sudden. So let's talk about your blood pressure. There's two numbers, like 120/80. That's the systolic over the diastolic. It's when the heart beats and throws blood out into the blood vessels. It has a pressure there. That's the systolic pressure. As the heart relaxes, the blood pressure relaxes. So a normal blood pressure is 120/80. Very important that we know how to take a blood pressure. It's not just put a cuff on and listen to it. So we should be sitting up. We should be relaxed. Both feet should be on the floor. The arms should be at heart height when the blood pressure cuff is on the arm to take the blood pressure. When that happens, then the manometer, how much they pump up the blood and how fast they let down the pressure to get the recording, should be about 3 or 4 units per second that we have. We call them millimeters of pressure. That will give us a blood pressure and tell the doctor a great deal of information about what's going on with your health. What does the blood pressure tell us? Well, number one, if the blood pressure is high, if the upper number is high, then that means that your chances of having heart disease and stroke are greater right off the bat. And so we need to think about that blood pressure, taking it again after you relax, having a blood pressure cuff at home. Remember, sitting up, feet down on the floor, arm at heart height, and then you push the button, it will inflate the cuff and then release it, and you'll get your blood pressure recorded digitally. There's an Omron IntelliSense that's recommended by the American Heart Association. Get one that's a cuff that goes on the arm. Don't get a wrist or a finger blood pressure cuff. Now, we mentioned 120/80. The difference between those two is called the pulse pressure. It's actually very, very important and gives the doctor a lot of information. If your blood pressure is 130/40, where there's a high pulse pressure that's right there, the difference between 130 and 40 would be 90. That would mean maybe there are some different heart problems like aortic insufficiency, a heart valve problem, or that there's an overactive thyroid that's making the pulse pressure high, a lot between the two numbers. So knowing what your blood pressure is. So when you have your blood pressure taken in a doctor's office, ask, hey, what was the blood pressure? What was it? And be sure that it was done properly. Be sure that you're sitting down, arm at heart height, because it will give the doctor a lot of information. What is your pulse? Well, a pulse is not just a simple thing. It's measuring a blood vessel after the heart is throwing blood out. You'll have a pulse. Very easy to feel the radial pulse in the wrist. There's an area in the elbow where we can take our pulse. We can take our pulse from the neck in the temporal artery, in the groin. There's an area on the foot also that we can measure the pulse. Now, what does the pulse tell us? If it's a resting pulse and the pulse is high, a normal pulse would be 60 to 80, somewhere in there. If it's a real high pulse and a weak pulse, that means maybe the heart is not beating as good. Maybe there is a medical problem going on that's making the pulse real fast. So a pulse is not just something to be taken lightly. It will help the doctor know exactly what's going on. So he'll be able to formulate an opinion just from your blood pressure, the pulse pressure, and your pulse. Respirations, we count how fast the person is breathing over a 60-second period of time. There are certain medical conditions, diabetes out of control, certain types of diarrhea, that make people breathe faster, and they'll breathe deeper and faster. And so that's called tachypnea and hyperpnea, medical names to tell the doctor what's going on so that he can begin to help. Then he's got to know how tall you are and how heavy you are. Nobody likes to know what their weight is. However, it may be one of the most important things that you can really take, because your doctor will be talking to you about your weight. It's a risk factor. If we're overweight, obesity is a risk factor for heart disease. So know that those vital signs are very, very important when you first come back into the office to start the physical examination. We mentioned risk factors to heart disease. Let's talk about those now. Very, very important that we know what factors are out there that may be detrimental to our heart health. Number one is smoking. What does smoking do to the heart? I thought we breathe it into the lungs and it damages the lungs. No, when we smoke and we inhale, then the nicotine and other agents in cigarettes will begin to damage blood vessels. And when those blood vessels are damaged, then cholesterol, another risk factor, can deposit in the blood vessel and cause hardening of the arteries. So now we have blood pressure. Now we know that there's a risk factor for somebody's weight, especially if they're smoking, if their cholesterol is elevated. If your cholesterol is too high, then the chances of you getting hardening of the arteries are good. If you get hardening of the arteries, the heart has to work against that. When the heart has to work against that, then it puts sometimes too much pressure on the heart. Sometimes the hardening of the arteries can be in the coronary arteries, the arteries that supply the heart muscle, its blood supply. If that begins to narrow, then we can start getting chest pain, chest discomfort, or the heart is not functioning as well, and we get shortness of breath. So we can begin to see how just the routine vital signs are extremely helpful to the doctor. If you're smoking, it's one of the most important things that you can do to stop. There are several ways that you can stop smoking. The American Lung Society has some aids that you can utilize to help you stop smoking. Secondhand smoke, that means being in a house or a car where somebody else is smoking, is also detrimental to your blood vessels and to your lungs. So know that if somebody is smoking, not only does it damage blood vessels, but it increases lung cancer, bladder cancer, esophageal cancer, and so lots of different cancers. So if you're smoking, know that it's something that we need to stop. So There we're beginning our physical exam. What do we find in the neck? The thyroid will be there. We're going to come back. We're going to talk about thyroid disease. Part of it can be autoimmune. Some can be an underactive thyroid. We call it the great masquerader thyroid disease. You'll want to stay tuned. I hope you've been able to understand the importance of vital signs. Remember, your blood pressure, your pulse, your height, your weight gives the doctor a lot of information. Now, as we begin the examination, let's start off with the neck, because the neck is so important. Number one, it has the carotid artery, so we can feel the arteries in the neck that are supplying blood to the brain. Actually, the doctor can listen over those arteries and see if there is a bruit. That's a noise, a lot of blood coming through a little hole there. That will tell the doctor maybe if there's hardening of arteries in that area. When we're looking at the neck, we want to feel the thyroid. The thyroid's a little butterfly-shaped gland in the neck. Really, if you look at somebody's neck as they're talking to you, sometimes you can see a swelling about this area of the neck. It's right below where the Adam's apple would be. And sometimes one side is larger than the other. And when somebody swallows, you can see the thyroid elevate itself right inside the neck. What can be going on with the thyroid? Well, a thyroid can either be overactive or underactive. First of all, the thyroid puts out a hormone that helps our cells have metabolism, gives us energy, gives our cells strength, warms our skin, makes our heart active. So the thyroid is so important. Let's see what happens if you get an overactive thyroid, if it puts out too much hormone. Usually there's swelling in the neck. It's what we call diffuse swelling. It's just generalized swelling there. Sometimes the patient's real nervous, they're talking real fast, and they're jittery, and they're perspiring. That's because the thyroid is putting out too much hormone. The pulse rate will go very fast. So instead of being 60 to 85, it may go up to 100, 110, and it may be a thready pulse, or it could even be a bounding pulse. But right away, the doctor can begin to see that the person is nervous, they're anxious, they're jittery, they're jumpy, their skin is warm, hair is thin. They tell you they're nervous, they're anxious, they don't feel well with an overactive thyroid. Now, there are blood tests, if the doctor recognizes these things, that are very important, and it's called thyroid stimulating hormone. That's TSH. Now, TSH is in the pituitary. The pituitary sort of regulates what the thyroid's putting out. If the thyroid is putting out too much hormone, then there's too much hormone in the system. The pituitary gland recognizes that, so it doesn't have to put out much TSH. So a low TSH, because the pituitary gland is not needing to stimulate the thyroid, means that the thyroid hormone is most likely too high. When that happens, there are several treatments that are available to be able to quiet down the thyroid, and it can be very important. We can have what we call thyroid storm that can be life-threatening from an overactive thyroid. Now, let's talk about an underactive thyroid. That same thyroid gland, rather than diffusely swollen, could become firm, a little bit swollen. You can easily feel it. The person is sluggish, their pulse is slow, they maybe have a hoarse voice, they don't feel good, they've got no vim and vigor, they've got no vitality, they feel tired, they don't feel good, and that's all because of the thyroid. Now let's go back to the pituitary gland and think about the TSH. If the thyroid gland is not putting out enough hormone, the pituitary gland sees that and it says, hey, you need to work harder, I'm going to put out more TSH. So at high TSH, the pituitary trying to correct the thyroid would go along with an underactive thyroid. There are several things that cause an underactive thyroid. Sometimes there's an autoimmune thyroid disease where the body begins to react against itself and begins to cause an inactive thyroid gland. It's the great masquerader because you can be overactive and hyper, or it can be underactive, depressed, slow, hoarse, constipation, huge amount of problems that go along with thyroid disease. If you walk into the doctor's office and say, I just don't feel good, I'm just tired all the time, first thing you should be thinking about would be your thyroid function, because it's one of the most common causes of fatigue and malaise. So let's go into fatigue. What are some of the causes of fatigue other than the thyroid gland? Well, number one, our society makes it where people have more things to do than they can possibly do. There's too much on their plate. There's too much that they need to do from the minute they wake up and from the minute they go to sleep. And so when that happens, the brain begins to be overwhelmed with the things that it needs to tell you to do. And it reacts by saying, you need to slow down. You need to take a little bit of time for yourself. And the body does that by making us feel tired. So sometimes tiredness is because of too much stress and anxiety in our society is going on. If people's blood count is low, the red blood cells carry oxygen that nourishes the body. If there's not enough red blood cells, then one of the things we get is fatigue. We may get fatigue, we may have paleness, the pulse may go fast and rapid because the heart is trying to supply more blood. So when we're tired and we're fatigued, we have to think about the possibility of anemia. We have to think about the possibility of thyroid. We have to think about the possibility of stress and anxiety. Any chronic illness. So if somebody has chronic arthritis and their joints hurt and they don't feel good, frequently a byproduct of inflammation of joints or inflammation of any body process is fatigue. That's because whatever is causing the inflammation puts out what we call cytokines. There are chemicals that make the body feel poorly. Again, I think it's a protective mechanism that people have because they're not functioning normal and the body is trying to tell us that we need rest, because rest will sometimes take care of some of the problems that we have that are causing fatigue and malaise, too poop to pop, and I just don't feel good. So are there other organ systems that can do that? Well, yes. Let's take inflammation of the GI tract, ulcerative colitis, Crohn's disease. Those are inflammatory diseases of the GI tract. Those are often associated with not only GI symptoms, but fatigue and malaise. So if you've got fatigue and you don't feel good, be sure that you discuss this with your doctor. Don't feel like it's something that should be normal. There are so many causes of fatigue and malaise. Routine blood count will look at your red blood cells. It will look at the white blood cell count to see if there's any type of chronic inflammation or infection. Thyroid function test can tell if it's a thyroid. The red blood cells will tell us if we're anemic. And then we usually will have liver function studies and other studies that are routinely done on the blood that will help the doctor know if there is a suggestion of something is going on. Now, if you're feeling fatigued and tired, then the doctor's next question should be, why do you think that is? Do you think it's you're overactive? Are you having pain anywhere? Because if there's pain someplace, that's not normal. It's the way the body is telling us that something is going on that we need to discuss with our doctor, whether it's headache, whether it's chest pain, or it's stomach pain, whether it's joint pain. All of those need to be investigated by the doctor. So be ready for the doctor when you go to see him. Write down your complaints. Write down the things that you want to discuss with him. And he'll be able to go over those each and individually and get the blood work and come out with answers and a treatment program that can help you feel better, be more productive, and be a happier person. Now, we're going to come back and talk about the eyes. Why do we get dry eyes? Can it be allergy? What are allergy symptoms of the eyes? What are allergy nose symptoms? What are dust mites? We'll be talking about that when we come back. We've got so much information that we could go over tonight. Maybe we'll get into chest pain. What can cause chest pain? It can be pretty frightening. You'll want to stay tuned. I want to spend some time talking about dry eyes. Some people just have to blink a lot. They don't lubricate their eyes enough. It's very, very common in people that are looking at a computer frequently. So if you're looking at a computer over 4 hours a day, then dry eye syndrome is something that frequently people have. Let's look at how the eye lubricates itself. The tear gland is usually on the upper outer side of the eye. It produces tears that cross the eye and then go down into a duct in the nose. So yes, actually tears end up in the nose. Now in the conjunctiva, the red part of the eye, there's also some glands called meibomian glands, and they put out a lubricating mucus. So we've got tears, we've got glands, we've got drainage areas. And if any of those go wrong, go bad, then you can begin to having dry eye syndrome. Usually just lubricating eye drops that you get over the counter. Tear replacement lubrication is usually all you need. But if the dry eyes, if the itchy eyes, if it feels like there's grit in the eyes, doesn't go away, have to see your eye doctor. He has to be able to tell you what's going on. I always tell people, you've only got one pair of eyes, so you want to be sure and take care of those. There's so many other things that can go on in the eyes. You know, we could talk about cataracts, we could talk about when you need glasses. When the eye doctor, a routine eye exam, when he dilates your eyes, he's able to look at the back of the eye and he can see normal blood vessels, how they perform in the body, and can get a good idea for other illnesses such as even high blood pressure, tuberculosis, heart disease, diabetes. All of those an eye doctor can tell just by looking at the eyes. Let's go to dementia. Let's go to the central nervous system. Let's talk about Alzheimer's disease. Everybody's worried about having Alzheimer's disease. The literature would say when you get to be 80, as many as 60 to 80% of people will have a type of dementia that's causing problems. Now, dementia is where it's a cognitive problem. We don't think as well. There's usually, in Alzheimer's disease, there's a couple of abnormal proteins that are in the brain that keep the neuron network from working good. And so we get that's nerve, fibrillatory tangles. So it looks like the wires in a system, in a phone system, are all tangled up so that you can't get proper thinking that's going on in the brain. Now, we know that there's certain things that will prolong getting dementia, Alzheimer's disease. They're usually exercise, it's usually eating well, it's usually doing the things that cut down on blood vessel disease. So there's another type of dementia called vascular dementia. And that's where the blood that supplies the brain has some hardening of the arteries, and so it doesn't nourish the brain. The brain takes more oxygen than any other organ, so we need to be sure that the blood supply to the brain is good. And then there's another entity that I think we should spend more time talking about, and that's chronic traumatic encephalopathy. And that's where people with sports, and it's usually sports, have recurrent head trauma. It doesn't have to be a banger. It doesn't have to really knock us out. It's just recurrent, repetitive. Actually, girls' soccer, where when the ball goes up in the air, they try and hit the ball with their head, causes actually more repetitive trauma to the brain than almost any other sport. So know that you need to be careful how we're taking care of our head and our brain as we're going through sports and going through activities that are so much for fun. So be careful of the brain, be careful of what you're doing as far as that goes. Now we're going to be talking about chest pain. We all know that heart attack causes chest pain. In men, it's usually a pressure pain right in the middle of the chest. It can radiate up into the neck or down the inside of the left arm. Those are classic. We break out in a sweat. Women are different. Women seems to have blood vessel problems going into the meat of the heart muscle rather than the blood that's supplying from the outside. And they may have sudden, unusual fatigue. They may get short of breath. It's abnormal. It's like shortness of breath they haven't had before. They may break out in a sweat. Women that have those should be thinking, could I be having a heart attack? Very, very important. When you think you're having a heart attack, that you seek medical attention right away, because if some of those blood vessels are blocked, then we have a period of time to open up those blood vessels with stents and with reopening the blood supply. I think that's all the time we had. I had so many other things that I really wanted to talk to you about. But let's go through those 4 things again that we want at the end of every Dr. Bob show. Number 1, exercise. Can't tell you how much of that's important to the blood vessels, to feeling better, to have a runner's high, to feel good, to be happy, to get new circulation around the heart. It doesn't have to be aggressive exercise, but you need to do it on a regular basis. Nothing like a Fitbit to get you active. Get 7.5 hours sleep. Know that sleep is so important to how you feel and how the people around you feel. If you're not sleeping well, think about why that is. Is it medicine you're taking? Is the house too noisy? Are the covers not good? Is it you just can't fall asleep, or if you wake up you can't get back to sleep? Eat properly. We're marketed to eat too much food in our society, and most of all, what is it we like in the Dr. Bob Show? It's that giggling laughter in your life. You laugh a lot and you're going to stay healthy, and everybody around you is going to be happier.